Good afternoon, everyone. This is Mark Burgess with Department of Commerce. Welcome to the afternoon session of the WIO Joint Training for the Governor's Guidance. Just a couple housekeeping items before we get started. There are a couple polls on the screen right now. If you would please complete those with both to identify both your local area as well as the organization, the core partner or required partner that you are working for. Most of us are familiar with the webinar setup. We've got a chat pod on the left. If you would present your questions or comments there during the presentation, we will then get to those when we have a break in the discussion. Also, the files are available in the file pod at the bottom left of your screen. We will be removing the polls here in a minute and bringing up the PowerPoint, the agenda. We will not be covering, but it just gives you an idea of what we have going on today. We have 4 sections, main sections. After each, we'll stop and see if there are any questions that need to be answered from the chat pod. We will also open up the phone line, so if you'd rather wait to that moment to present your question or comment in the through the telephone line, you certainly can do that, and we'll let you know when those times are available. We've got staff from Kerber and Breckel presenting today, and with that, I'll turn it over to Skip Hedger to start the discussion. Thank you.
Good afternoon. This is Skip Hedger with KEB, and thank you for participating in this webinar, which is the second of 6 that have been planned for the first 3 days of this week. The topic of the webinar is the guidelines that governors in all states, not just Illinois, are required to issue under WIOA. Those guidelines have been made available a number of different ways, and presumably each of you has had an opportunity to review those. As you can see from the agenda, the structure of this webinar is by design relatively light on presentation, and the reason for that is to maximize the amount of time that you have to ask questions of clarification about the items presented today. I anticipate that I will be answering some questions that come up. Also anticipate that I may ask representatives of required program partners who are on the call to respond to some questions that are more appropriate for their response rather than a response from here. Regarding the questions, again, we would request that you write those in the chat box so we don't lose them. There's generally a large number of people participating in these webinars, and we want to make sure that all questions that you have, there's a chance to get them raised and responded to. And just know that it is our plan to develop a comprehensive Q&A document that will be distributed following the completion of all 6 webinars, so you'll have that as a reference point as well. So with those opening comments, I would begin the webinar by providing an overview for you of how this is going to work today. Very briefly, I'm going to provide a little bit of context and background for the governor's guidelines, and then we're going to proceed through the content in 4 main segments that are shown on your screen. The way we're going to do that is with a short presentation in each of the segments, followed by a longer period of time for Q&A. So with that, we will get going then. You want to advance the slide, Barry? Okay, thank you. So to begin with the basic purposes of the governor's guidelines, the primary purpose is, as I mentioned briefly, is to fulfill the requirement under WIOA that the governor of each state develop and promulgate guidelines to state-administered programs as well as to local partners regarding the negotiation of shared costs and services under the Workforce Innovation Opportunity Act. The second is to optimize service quality and value for customers, and this happens primarily through integration and better alignment of all federally funded workforce programs. That is one of the major goals of WIOA, and so these guidelines are intended to optimize service quality by more integration and better alignment of services. And then, importantly, to establish ground rules for cost sharing. As everyone knows, there's a considerable requirements related to cost sharing under WIOA, and those will be a major part of our agenda for the webinar today. The webinar objectives are to provide all local partners, representatives, the same information in a common setting so that everybody's hearing the same information at the same time, and also the opportunity for local partners to not only ask questions that you have, but also to hear questions that others are asking, others that may be also in the same program as you may be if you're asking a question, or questions from different programs. The other item I would mention is that, as you know from reading the governor's guidelines, there are a number of resources embedded in those guidelines. I'll give you a few examples of what I mean. One is that there's a glossary of 10 key terms, and you can find those on pages 11 through 13 of the guidelines. So again, some of the terms that are used throughout the guidelines are defined specifically on this glossary. There's also a summary timetable on page 14 that is a resource for reference, so you can see at a glance what the timing is that's associated with this. And we're going to go through timing and the timelines in the final segment of this webinar. And then, of course, there are the service matrices, which are included as an appendix to the guidelines, as well as other resources. So just know that the guidelines are accompanied by a number of documents that are resources to you as you begin to do the hard work that's in front of the local areas to negotiate services and costs under WIOA. We're going to begin this webinar and this segment of the webinar with some general guidelines for local MOU negotiations. As you saw in the guidelines, there are a number of principles that are articulated upon which the guidelines are based, and some of those principles are shown on this slide. Principles like the MOU is to be an important tool to achieve this integration. Principles like to reflect the shared vision and commitments of local boards and partners. That the negotiation of local MOUs is to be only by individuals who are empowered to make commitments for a partner, both financial and programmatic commitments. That's something that is very important in MOU negotiations, is that the individuals who are doing the negotiating are in fact empowered to commit the partner program financially and programmatically, and also that that all negotiations are in good faith. There are other principles as well, but I wanted to highlight these as we begin this segment of the webinar. Okay, Mark. So what are the basic decisions that need to be reflected in the MOU? There are many, as you know. The services that are going to be available in local one-stop delivery systems, that is a decision of all the local partners that will be reflected in the MOU. The location, and again, in those decisions, the service matrices that are included on pages 15 through 21 of the governor's guidelines are a good starting point for those local conversations about which services. The locations at which services will be provided, those locations, as everyone knows, must include at least one comprehensive one-stop center within each local workforce innovation area, but could also include affiliates or specialized centers. So whatever the configuration is of services in a local area is to be reflected in the MOU. The method of delivery under WIOA, partners have flexibility with certain limitations. A couple of partners have less flexibility, but most partners have flexibility to determine the method of service delivery, whether by on-site staff, through technology, through contractor staff, as examples. Whatever the specific method of service delivery is, is to be reflected in the MOU. The role of the comprehensive one-stop operator is also needs to be described in the MOU so that all partners understand what the operator's role will be and how the operator will function in a number of ways, including the coordination of referrals. That's an important component of the MOU, and that too how that's going to work would be reflected in the MOU. And then there's the whole topic of how one-stop center infrastructure costs and local one-stop delivery system costs will be shared. That's those decisions get reflected in the MOU, and we have separate segments in today's webinar on each of those two. So we'll be covering those in more detail and focus your questions on those two areas later on. So at this point, I would stop after the brief presentation regarding general guidelines for local MOU negotiations and ask if for this segment there are questions of clarification that you would like to raise in the webinar. Okay, I'm not seeing a lot of questions, Mark. No? Okay, going. Okay, that's fine. That's fine. There's not a lot profound there. My guess is that there will be questions in the next segment. So that segment is on infrastructure costs, and this slide that you see now is the definition from the law of infrastructure costs. And as we all know, infrastructure costs are the non-personnel costs that support the operation of a comprehensive one-stop center. So the non-personnel costs associated with a comprehensive center are infrastructure costs, and these are things like space rental, lease costs, utilities, the items that you see on this slide. I would mention that on page 24 of the guidelines, there is a list of infrastructure cost items and definitions associated with those infrastructure cost items. So that's the introduction to infrastructure costs. Under WIOA, there are two funding mechanisms for infrastructure costs: a local funding mechanism and a state funding mechanism. I'm going to talk about the local one first, but know at this point that there is a comparison chart on pages 22 and 23 of the Governor's Guidelines that compare the major differences between the two methods of funding of infrastructure costs under WIOA. Beginning then with the local funding mechanism. And this is not a term that the governor decided in Illinois. It's a term that's in the regulations, the WIOA regulations. So the local funding mechanism is the funding mechanism for one-stop center infrastructure costs that's used when all the partners agree on how those costs are going to be shared. When there is agreement, that's the local funding mechanism is used. What are some of the features of the local funding mechanism? First is that in-kind contributions are allowed under the local funding mechanism. So those contributions would need to offset the cost of the infrastructure costs, but nonetheless, in-kind contributions are allowed under the local funding mechanism. Also under this mechanism, there are no new statutory caps on partner contributions, and what new means is that WIOA does not impose caps on the maximum amount that each required partner can contribute toward infrastructure costs. Now each program partner has to comply with its own enabling legislation and its own regulations about what can and can be done within that program, so that's always present, but there are not any new statutory caps that apply under the local funding mechanism. Another feature is that there is a possibility of sharing infrastructure costs for multiple comprehensive one-stop centers in a local workforce innovation area if the partners agree that they want to have more than one comprehensive one-stop center. The requirement is that there must be at least one in each local workforce innovation area, and if the partners agree to have more than one and want to fund the infrastructure costs associated with that and those others and agree to do that, then that is possible under the local funding mechanism. And then finally, there is increased flexibility that is available under the local infrastructure cost funding mechanism to determine the basis on which infrastructure costs are going to be allocated. Essentially what that means is any reasonable basis of allocation that is consistent with the Uniform Administrative Standards, the new OMB circular, can be used. The preference, as you noted when you reviewed the governor's guidelines, is that FTEs be used as the basis of allocation. You'll hear me say in a minute that that's actually required under the state funding mechanism, but there is more flexibility in determining the basis of allocation in the local funding mechanism. So that's the local funding mechanism. The second of the two funding mechanisms is the state infrastructure cost funding mechanism, and this is the way infrastructure costs get funded as a last resort if there is no local agreement and if attempts to negotiate agreeably what the infrastructure costs are in a local area or for a comprehensive one-stop center, fail, then the state infrastructure cost funding mechanism kicks in, and it only kicks in when there is failure to agree locally. So what are some of the key features of the state infrastructure funding mechanism? The first is that in-kind contributions are not allowed. Unlike the local funding mechanism, where contributions, if all partners agree, can be in kind, that's not allowable. There is no provision for that in the regulations for the state funding mechanism. So in the state funding mechanism, we're talking about cash contributions that all required partners have to make. Again, unlike the local funding mechanism, the contributions, the maximum contributions that each partner may make under the state funding mechanism is subject to a new cap that is defined in WIOA, and with a couple of exceptions. That's 1.5% of something, either 1.5% of administrative costs or some other way of defining what the universe is to which 1.5% is applied. For some partners, it's 3%, but there is the governor's guidelines do reflect in an attachment what those specific caps are. And again, these are caps that are in the law. Also under the state infrastructure cost funding mechanism, funds under that mechanism are only available for one comprehensive one-stop center in each local area except for LWIA 7, the Chicago-Cook County area. Other than that, only one center may have its infrastructure costs funded through the state mechanism in each local area. And then finally, there is a provision for forced partner acceptance of infrastructure costs. It's a possibility, and what that basically means is that if a partner refuses, it is allocated costs and says, no, I can't agree to those costs. And if the amount that's being allocated to that partner is equal to or less than the amount that would be applied under the state funding formula, which is also definition is included in the glossary, but if it's equal to or less than that amount, then the required partner is going to be forced to accept that allocation of costs and won't have the opportunity to disagree with it. So those are the two funding mechanisms, and then just to bring the presentation of this segment to a close and to get to your questions about infrastructure costs. One is to say that the expectation is that there will be local agreement and that the state funding mechanism will be used only as a last resort when agreement cannot occur. Allocation of costs, the preferred method is FTEs, and it's the required method, actually, for the state funding mechanism. And FTEs, full-time equivalents, using that as the basis of allocating costs, we're talking about both FTEs of site who are physically on site at a comprehensive one-stop center, as well as FTEs that are supporting the services at that center off-site. I mentioned before that partners have most partners have the flexibility to decide the method of service delivery, and one of those methods is technology. And there are some significant requirements about what that means that mainly go under the heading of direct linkage. But and what that essentially means is that if you're going to provide the services via technology, you basically have to provide on-demand access, real-time access to the services to a staff person who's not physically located at the center, but can provide the service as though he or she were at the center. So those FTEs that support service delivery via technology at a local center are also counted in the FTEs that determine the allocation of costs. So that's an important thing as well. And other allocation methods are possible under the local funding mechanism, again, as long as it's consistent with the Uniform Administrative Requirements Circular. So at this point, having described the infrastructure costs generally and the two funding mechanisms, I would stop and invite your questions about infrastructure costs and their negotiation.
The first one, Skip, is from a Perkins, CT, and adult education perspective, looking at those guidelines, the local funding mechanism is blank, whereas it's listed for the state funding mechanism. Does this mean that for these two programs, the state is paying 1.5% that covers all LWIAs, or are these programs required to use the local funding to cover the infrastructure costs? Since it is a last resort, we think not, but with nothing listed on the local box, we want to be clarified.
Thank you. That's a good question, and it's more of a presentation on the table than it is anything else. So the blank next to all of those programs, including Perkins, Career and Tech, CTE, and Adult Ed, is not intended to imply that it doesn't apply to them. What those detailed listings are subordinate to the row at the top that says limitations or caps on partners' contributions. And under the local funding mechanism, that's the only thing that's relevant, only as imposed by statutory and regulatory requirements. So that's the operating guidance for all of the programs, with the exception for all the programs. Then if you look on the right side, where you see the state funding mechanism, that's where the percentage limitations are. So what this table is attempting to reflect is that under the local funding mechanism, there are not any new caps imposed on any programs for funding infrastructure costs, whereas under the state column, there are caps, and these are shown on in that column on the far right. I hope that responded. If not, you can ask a follow-up question.
Someone is wondering if you can give some examples of meaningful in-kind contributions.
Well, that's a good question, and the general concept is that the in-kind contribution made has to be a true offset to the costs incurred, because since these are non-personnel costs that go along with a one-stop center, these are bills that need to be paid. So whatever the value is of an in-kind contribution has to really result in the effect of freeing up cash somewhere else that can be used to pay those bills. I'm trying to think what a good example might be. So if, for example, this may or may not be a good one, if if the partners of a one-stop center were going to say, we need a front-end service person at a one-stop center, and I realize this isn't an infrastructure cost, but one partner said, we will provide that, and the partners all agree we're going to chip in and pay for that front-end receptionist or whatever. And one partner says, we will provide that out of our program. And all other partners agreed they would chip in on the cost of that person. They would no longer have to chip in on that, therefore, on that person. Therefore, they would, the cash that they were going to apply to hire that person could now be applied to infrastructure costs. The in-kind contributions is really, you know, it's, again, the concept is clear. The application concept may be less clear. And it is situational, and it is local, and it does depend on what those costs are locally and what those contributions are, those in-kind contributions are locally, and the value they have to the other partners. It has to be of acknowledged value, or else it's not an in-kind contribution. If the other partners say, you know, that's fine, but that doesn't do us any good, that's not really an in-kind contribution that has the offsetting value that would be required to in effect free up funds that fund the infrastructure costs, because one partner may not have the cash or want to use the cash resource to do that.
I'm just going to take a shot at some examples. Would equipment, desks, furniture, things of that nature be examples? If someone has an excess of those items that they can offer to that center, would that be an example of infrastructure that's in kind?
If I am a partner coming into a one-stop center and I need to buy new desks or new equipment to be able to put my people there, and some other partner says, we have excess equipment, we have excess desks, so you can use those, that would be an in-kind contribution. But the key, though, Mark, is that the money that partner was going to pay to buy new desks and equipment they would not now need to use that money to do that, and could cover the contributing partner's portion of the infrastructure costs. So that would be a good example. But it really, again, the key is, does it create the offsetting cash value that enables the contribution to happen?
Okay. Someone's asking why some programs have to allocate a specific percentage of both program and administrative funds, while others only apply a percentage of administration funds. That's
a good question, and one that's real easily answered, and that's because that's what the law says. And why it is, for example, that the CSEP program, the base that's used to calculate those contributions, is both administrative and program funds, whereas in another program it may just be administration funds. I don't know. There's no explanation of that in anything the feds have released related to that, but there are some differences in what the cap is computed on. Mostly it's administration, but for a few partners it's more than that, as shown on that comparison table. But what the underlying logic is, it escapes me. I haven't been able to figure that out.
Right, and it's just on state funding mechanism.
Yeah, and again, it just as a reminder, those caps only apply on the state funding mechanism, not under the local funding mechanism.
Is the one-stop center the sole entry and intake point for any adult, or really any customer, that needs services from all of the four core partners? It is important to know this because intake is such a large operation for adult ed, and I imagine for other partners as well, where students get tested and registered. It would be good to know if this operation is covered under the one-stop center.
Well, the requirement, the specific requirement under WIOA is that adult ed services, as well as the services of all the other required partners, have to be made available through the one-stop center. And presumably intake is a service that is required to make in the adult ed program. So simply put, at every one-stop center in the state of Illinois and around the country for that matter, there must be an ability for someone to walk into a comprehensive one-stop center and go through intake for adult ed. Now that can be because you've got an adult ed staff person or contractor located at the one-stop center, and it could happen that way, or it could be because you have some real-time, on-demand, direct linkage technology access to a person off-site who can, again, provide the intake as though the person, a staff person were on site. So the answer, I think, is that the requirement, not the expectation, but the requirement is that there be an ability to provide, to do intake at every comprehensive one-stop center somehow, on site with staff or via technology. Levon, if you're on the line and want to add or subtract from what I just said, please feel free to do it.
At this point, let's see, I'm reading the question to make sure. No, not at this time. Go a little further and then maybe I'll jump in.
All right, that's fine. That's fine. So I hope that responds to that question.
Okay, another question is asking if you would explain the FTEs and how it works for the method of allocation of infrastructure costs when an FTE basically is a staff cost. And I mean, it's a method of staff cost.
Well, yeah, but it's an allowable basis of allocating costs. You've got two things going on. First, you've got infrastructure costs that are not staff costs. These are the non-personnel items that support the operation of a local one-stop center. So that's the costs that have to be allocated. And those are finite. In your negotiations, you're going to define what those are. And you'll sum them up and you'll know what the total amount is. Now, the question is, what's each partner's share of those costs? And how do you determine that? What the governor's guidelines say is the preferred method to do it under the local funding mechanism. The required one under the state funding mechanism is FTEs. FTEs is, it's not the only method. It is the only method under the governor's, the state funding mechanism because the governor has declared it so, but it's not the only mechanism under the local funding, or the only allocation methodology under the local funding mechanism, because there are other bases of allocation that could be used, and those of you that have been involved or are involved in cost allocation know what those are. Sometimes it's square feet, for example. But so we're talking about two things. One is the costs, and those will be defined, and now it's how do you get those costs to each partner in proportion to the relative benefit that each partner receives. And that's the allocation basis, and that's where you get to FTEs, and it's a real simple calculation once you get there. The total, whatever your portion is of the total FTEs, both on and off site, that percentage is applied to the cost, and that would be your share of those costs.
Okay, Levon, go ahead. You said you're indicating you want to respond now.
Right. So we were talking about the question because I had my phone lower and I had a hard time hearing Skip. So the question from Arlene Santos George?
Yes.
Okay. Is the one-stop center the sole entry and intake for any adult that needs services from all? Well, for adult, no. You still have your provider locations. You know, it's one point, but it's not the only place that adult ed, potential adult ed students would get tested and registered. No. And depending on what you decide, you know, of the services that are going to be offered in the one-stop, it may you still may be doing more back at your provider location. It's, you know, you just need to make sure that, just like they were talking about on the infrastructure costs, that your services are provided in the one-stop. That doesn't mean that's the only place you provide services. It just means that services are provided there, but you still have other locations. Is that what the question was asking?
Yeah, and I thank you for that clarification, Levon, because I did not address that in my response. But you're absolutely right. What I said is true, that intake would need to be offered at the comprehensive one-stop center, but would it not be the only place that that you could be brought into the adult ed program? You could do that at other locations multiple locations, presumably, however that looks now. The relevant point for WIOA, however, is that one of those locations, one of those many locations, needs to be the one-stop center.
Right, exactly, exactly. So was that sufficient?
Yes, Levon, if you want to stay on, we've got
Okay.
a follow-up to that. Then how does this affect tracking of the students if they met WIOA objectives and performance metrics?
Okay, so then if you're talking, I'm just going to stay with adult ed, but I think it's fairly, it doesn't matter where the student gets registered or does their intake, if they're an adult ed student and they're being registered for adult ed, they're going to count under the performance measures, the adult ed performance measures. Is that the question?
I think maybe if I'm, and hopefully I'm going the right direction.
Co-enrolled. Oh, I'm sorry, Mark.
What's that?
No, I interrupted you. Go ahead. Thought maybe she meant co-enrollment.
Yeah, that's what I was going to go. I said, I think because this is kind of new under WIOA that ultimately the system should have a single intake method as far as maybe a computer or something, because right now, going forward in WIOA, every program has their own system of intake and tracking, and they're not very well linked, if at all. And so to respond to Arlene's follow-up question, everyone at this point in time is responsible for a customer utilizing their program.
Right.
And will be, that person will be counted against their performance, but ultimately, in time, it should be where really one system can track them all the programs, one customer in whatever program they might have a part in it. You know, an example being someone that starts maybe at Voc Rehab and is referred to adult ed for some assistance, but also needs some supportive services to get through the adult ed. Well, there's three programs, and right now those are three
Yes.
distinctly different systems, and it has to be that way till another better
Right.
system is implemented. So, hopefully that in a roundabout way answers that right now nothing really changes as far as tracking. You do have to track them, and unfortunately it's in multiple systems, but in time hopefully that will not be the case.
Well, and just to reinforce Levon's point that for purposes of performance metrics under WIOA, it doesn't matter where that individual participant is attached to. If that's an adult ed participant or any other program participant, then that individual, the outcomes for that individual are going to be factored into the performance
Yes.
measures, regardless of the site of original intake or where that person is being served from physically. It's still going to count for performance purposes.
That's right.
And so the data integration piece of this is obviously important, and it's also not present yet as it needs to be, and that's something that is, continues to be a conversation at the state level about how to do that. But pending that time, each individual program must track its own participants and will be responsible for the performance outcomes for all those participants.
Hopefully, Arlene, your next comment was as much in jest as anything, because it's not excluding you from tracking those individuals, and I think you understand that and are just making light of the fact it's a long process to get to one system. But there are states that have got there. Some states got there under WIA, so it's not something that can never be reached.
It's a big conversation though, and one that is underway. Are there more questions about infrastructure costs for this segment of the webinar? We have more time available if there are.
Yeah, I see one person typing, and keep in mind when we open up for questions, those that want to ask over the telephone, find a silent moment in the conversation when we've answered somebody's question already, and don't hesitate to ask over the telephone if that's a lot easier method than trying to type it in. Sometimes I know these chat pods are aren't the easiest things to type in and get your message across. So you're more than welcome in these open sessions to ask the questions over the telephone at an opportune time. So
either way is fine, yes.
So simply put, a one-stop is another physical location for potential customers / consumers to register for services.
Well, it is that plus. You do more than register for services as a one-stop. And I would refer you to the service matrices that are part of the governor's guidelines that indicate how the particular services that are required to be made available at the one-stop. And not to get into all the details of that, but there are two types. The first type is career services, and there are 13 different types of career services, and you'll see on the matrix which ones of those 13 apply to that program partner. And let's say all 13 do, then all 13 services would be made available at that one-stop center, not just registration. So it's broader than registration would be one, but it's also broader than that, and the authoritative source on that is obviously the WIOA law and the regulations, but the next level of that are the service matrices that are included as part of the governor's guidelines that indicate how the required partners are seeing which services they see as being required at each local comprehensive one-stop center.
I think that's all of them for this segment. Skip, if you want to.
Okay, I think we'll have a moment of silence to let people think about whether there are more infrastructure questions, because this is a big topic, before we move on. And if you don't, that's fine. It won't be your last chance to ever ask questions, but we'll just take a moment here and see if there are additional questions before we move on. Okay, hearing none, then we'll move to the third segment of the webinar, and sticking with the general topic of negotiation of shared costs, we're going to broaden the conversation away from infrastructure costs, which are the non-personnel costs associated with a center, to shared local service delivery system costs. So the slide that's on the screen now provides the definition of shared systems costs, and this is the definition that is included in the glossary that's attached to the governor's guidelines. So basically, these are additional non-infrastructure costs to which the required program partners must contribute, and I would observe that there is also an attachment to the governor's guidelines with examples of what these other system costs are. I'm going to go through some examples here in a minute, but there is also an attachment to the guidelines that provide examples. Okay, Mark? So what are some key points related to the sharing of local one-stop system costs? Again, distinguishing from comprehensive one-stop center costs. That's infrastructure costs. These are systems costs. So the first point to make is that all required partners, all of them, are required to share in these costs. So whatever they are, all required partners must bear a portion, their proportionate share of those other systems costs. Whatever those costs are will be determined locally. There's no going in requirement that says these are by definition shared costs and must be always and shall. But instead, whatever those system costs are to be shared are determined locally by the local partners through their negotiations. In-kind contributions, which would be similar to the discussion about in-kind contributions for shared systems costs, that is, they must have an offsetting value, are permissible for local one-stop delivery system costs. And that under the governor's guidelines, the priority is for shared costs that promote integration, which is a key goal of WIOA, streamlining service delivery, which is also a key goal, and to leverage resources across programs, or to improve program outcomes. So those are some key points to make at the beginning of this segment on local one-stop system, delivery system costs. So here are some examples of what these costs are, costs which I will reiterate are whatever it is you agreed to are shared costs. It's not an option that you share those. It's a requirement that those be shared among all partners. So the first category of possible shared delivery system costs, understanding that these are just examples and not intended to be mandatory requirements, but the first category is costs that support local board functions, local workforce innovation boards. Those are deemed to be local service delivery costs. So what are some examples of those costs? Salary and benefits for local workforce innovation board staff would be an example. Board meeting costs. The other costs that you see shown here under this category. The costs of strategic data gathering, analysis, or other projects that a local board decides to engage in that have local area-wide and cross-program impact would be, to the extent that's relevant, would be an example of a shared system cost. The other category, the second category are costs to promote integration and streamlining, and these are some examples of those costs. Joint training and staff development for one-stop center staff, or it could be affiliate staff or specialized center staff, or other staff who are critical in the local service delivery system, but joint training and staff development across programs. Customer satisfaction measurement costs would be another example. Business services costs, receptionist costs, resource rooms. All these are just examples of potential costs that that local required partners at the direction of the under the local workforce investment board can agree that they are going to share in these costs in a particular local area. So at this point, stop and open it up to questions.
LaVon is wondering, I think because she's been involved somewhat in those discussions, and thinks that the state level partners had made some decisions regarding which shared system costs the locals would fund. Is that correct?
Now, didn't we, thank you, Mark, I'm looking to try to, I've got that chart, of course I've got a blank one, but where we actually identified the, some that we thought that we would we knew our locals would need, and so, or would be participating in, so we checked off that those would be ones that they would be funding. Then there were some that weren't pertinent at all, and then we said no on those. Am I hallucinating?
Well, no. Okay. We had that conversation. When I say we, I mean the conversation about that was had in detail at the interagency work group meeting. Right. The outcome, though, was not clear because there were different perspectives about that, and so there was no agreed upon set of costs that were deemed to be shared system costs that would be shared, that there was agreement to always share.
Right, because each partner identified, though, which shared systems costs were appropriate for them to fund.
Yes. Yeah,
okay, that's what I was getting at.
That was all part of the discussion, yes. But there was no...
But that chart isn't in the governor's guidelines.
List of what that looks like. That came out of that process.
Okay.
Despite, attempts to try to get there, I just think we didn't.
I just couldn't,
get
yeah,
there.
I didn't mean to muddy the waters.
No, that's fine. It's a question I'm sure others are wondering, and I'm also sure that this will be an area that the state-level required partners will provide additional guidance to their local representatives as these negotiations begin.
Right. Just because I know Adult Ed had specifically identified some that definitely made sense to fund and some that did not.
Right.
Yeah. Okay.
And if we can if we can revisit that and pull together a nice matrix that displays all that says, this partner's funding these and not funding those.
Right.
It'd be a good thing to do, but
right.
I think we weren't able to get there.
Okay. All right. I think that I misunderstood. Thank you.
All right. I'm going to kind of try to interpret Vince's comment. He said, will the WIOA director and staff be the ones who direct the MOU creation and negotiation process? And I'm going to assume, Vince, and correct me please if I'm wrong, that you're kind of referring as a WIOA director to Title 1B. And then, so with that in mind, Skip, can you answer who's directing the MOU creation and negotiation?
Yeah, if we could just hold off on that because that's the next segment.
Okay.
The next segment of this webinar is on the MOU process and timeline, and we will cover that then. So we'll get a response to that question.
Meg, we have not necessarily specifically outlined who the partners are. There's 16 or 17, depending on which area you are. But the four core partners are Title 1B, which is the workforce and training services, is what we like to be called. Title 2 is the adult education programs. Title 3 is Wagner-Pizer. And Title 4 is vocal rehabilitation, and here in Illinois, that's provided through Department of Human Services. So those are your four core partners, but certainly as you listen to this, keep in mind that the other 12 to 13 partners are all in the mix, as well as sharing of costs and space and requirement to provide the services at a comprehensive one-stop if they are required to be there because they exist.
Yeah, and just to put a little finer point on that, there are the four core program partners that Mark mentioned, but the requirements that we're going over in this webinar apply to all required partners, not just the four core. So when I say that the governor's guidelines say that local service delivery system costs must be shared, that's not just by the four core program partners, it's by all of them. All required partners, and that's the same for infrastructure costs. The only two distinguishing features of core program partners are, one, the four core program partners have to, under the law, develop what's called a unified plan, and that's being worked on. And the second is that the four core program partners that Mark mentioned are held jointly responsible for performance in the same performance measures. Those are the only two differentiating points for core program partners versus required partners. In terms of MOU negotiations, service delivery, what services, how, methods, costs, infrastructure, systems costs, all partners are the same, whether you're core or required, it's the same. So it's a good question.
As far as the matrix that Skip has referred to multiple times, again, that's available in those governor's guidelines, which are available on the WIOA implementation site or at the end of the agenda document that's available in the files pod, starting on page 15. So you'll be able to find what we're talking about. Now, there's indication maybe, Levon, what you've referred to, is that different?
Yeah.
Okay.
It is. It's different. What the matrices that are in the governor's guidelines, there are two of them. One is the 13 core services and tells you which of those apply to which required partner. So it's definitive in that respect. And then the other matrix is on program and activities in each of the required partners that also have been deemed to apply to the one-stop comprehensive center. So that's beginning point guidance for local areas as they begin to define which services locally are going to be made available in a one-stop delivery in a comprehensive one-stop center, and how those services will be made available. So those are, Levon was referring to a whole different piece around decisions about which costs will and won't be funded by a partner.
And their concern is having those available when these negotiations start. Are they going to be available? All of these?
The cost that will and won't be funded? I doubt it, because we couldn't get there before.
Yeah.
I mean, we're going to revisit it, and I was a strong proponent of having that. But there's just a lot to that, and again, we'll revisit it. But I can't commit that there's going to be this definitive matrix that shows which costs will and won't be shared, uniformly across the board, statewide, across all partners, because it's just very difficult to get there. And it's the nature of these programs is local. I mean, these are local programs and uniquely local decisions around what service delivery systems look like and what needs are and what costs are to be shared. So any additional guidance, my guess is, would be appreciated about cost sharing, but in the end, it's up to the local partners in each area to figure all that out.
Which answers Lynn's follow-up question that they should proceed as though everyone is sharing, and then the negotiation would dictate differently.
That's right. That's right. Open, negotiate in good faith. That's one of the principles, is to begin these negotiations in good faith and together decide on what this looks like. Services, methods, costs, infrastructure, all one-stop centers. It's a local in nature and orientation.
Are there any other questions for this segment, either via the telephone or chat pod? We'll give you a moment to start those if you do have some additional questions or have some comments you're holding on to.
Okay, then we'll move on to the final segment of the webinar, and in this segment, we'll be sure and address the question that was raised earlier that wasn't addressed, and some of that may happen in my presentation, and if it does not, please re-raise the question. So this segment of the webinar is on the negotiation process and timeline for the MOUs, which a component of which is infrastructure costs and other shared costs. So starting with the process, under the governor's guidelines, the local board chair, that's the chair of the local workforce innovation board, is required to appoint 2 people, or not required, or could retain this responsibility him or herself if that's the choice. But the guidelines suggest that the local board chair appoint an individual to lead the MOU negotiations, and does not provide a lot of direction about who that individual is. The second requirement of the guidelines is that the local board chair appoint a private sector board member or other impartial individual to lead all the negotiations on costs. So from the standpoint of the negotiations, which, by the way, these agreements are between the local Workforce Innovation Board and CEOs and all the partners, and they're led by the local board. So the local board, in initiating these negotiations, appoints the 2 individuals as shown on this slide. So in terms of some broad stroke information about timelines, the memorandum of understanding must be negotiated at least every 3 years. If you decided you wanted to do that every year, you're welcome to do that in a local area, but you also have the flexibility to only negotiate an MOU and all that is associated with that every 3 years. The exception to that are shared costs, which must be negotiated annually. So both the shared one-stop center infrastructure costs as well as the shared local service delivery system costs do get negotiated annually, unlike the MOU, which may be negotiated every 3 years. So in general terms, and some of this relates more to the first time doing this under WIOA, is there's a 90-day period for negotiations. And that assumes that that period would begin January 1st of 2016. In reality, the MOU negotiations can begin anytime you want them to begin. In the first year after today, in future years you're negotiating an MOU, you can begin those whenever you want. But in terms of this initial period, there's a 90-day negotiation period that's described in the guidelines, and there must be a report from each local area at the end of the 90 days regarding the outcomes from those negotiations. And there's a facsimile of a form that you would use to report those outcomes included at the end of the governor's guidelines on page 28. In that form simply says you either did, the local partners either did or didn't agree, and provide, if you didn't agree, provide some reason as to why. For those local areas who report by March 31st that they have not agreed, the guidelines provide for a 45-day period of remediation, during which a state level team comprised of core program partners and other required partners, depending on the circumstances, would try and facilitate local agreement during a 45-day period. So this team would presumably get into the reasons for disagreement and try to work that through with the local partners to get to agreement by the end of the 45-day period. So 90 days for negotiations to begin with, reporting at the end of 90 days, 45-day period of remediation if there is an agreement, and then the MOU would be signed by July 1st of 2016, or by July 1st of any other future year in which you negotiated an MOU. So on the shared costs part of this, there is included with the guidelines a facsimile of a budget format. The actual budget format that you will use will likely appear a little different, and certainly it will be supported, whether it's an Excel spreadsheet or whatever. Ultimately, it will be developed to be easier to complete. But to give you an idea of what the budget looks like, that is included as in the appendix to the guidelines. The budget is to be developed in stages as described in the guidelines, with the draft budget due to be submitted to an individual the governor is yet to designate by February 28th. And then a final budget would be, there would be the reporting at March 31st as to whether there is an agreement, and a final agreement. If there is agreement, a final agreement would, or final budget would be included in the MOU, which would be due July 1st of 2016. There is a requirement that the allocated costs, infrastructure costs or local service delivery system costs, be reconciled to actual costs. This is a requirement periodically that there be this reconciliation of actual of allocated to actual. So that's also described in the governor's guidelines. This is just a summary time line that essentially describes everything I just said. On or before January 1st, the start of the MOU negotiations. By February 28th of 2016, the draft budget. By March 31st, the reporting on the outcomes from negotiations. By the a 45-day period of remediations beginning April 15th, ending at May 31st, 2016, with MOUs being submitted by July 1st of 2016. So that's the presentation of information summary, and obviously there's more detail on all that included in the governor's guidelines. But with that summary of the process and timeline for MOU negotiations, are there questions now that you would like to raise?
The first one is, what would a timeline look like for co-location once all these agreements are made to get everyone into a comprehensive one site?
Well, number one, you're making an assumption that everybody's going to choose to physically be present, and that may not be the case. Because there is the option of providing services via service delivery. What was the other part of the question? I'm sorry.
Just, is there a deadline to get that worked out?
Yeah.
To actually make it happen once the MOU is agreed?
Well, right. And then once you know who it is that is going to be physically co-located in a comprehensive one-stop center, that, you know, you've got a lot of issues related to that, lease issues, space issues, all those things. And I think that in an ideal world, all that would be tied up in a nice little bow by July 1st of 2016, but that's not the real world, and that's not going to happen. There is the requirement, for example, that everyone knows that Wagner Pizer services can no longer be standalone after July 1st of 2016, and the regulations make an allowance there that recognizes the complexity of going from what may exist today to what has to exist under WIOA, and allows for a transition plan. So it's probably reasonable to say that if circumstances locally are such that that it can't look the way the local partners in the board wants it to look on July 1st, that the MOU would describe what it's evolving to and when it's going to get there, because it's just not realistic to say that all this, you know, is going to be decided in final form by July 1st. I think the pressure is there to get as far down that road as you can, but there's got to be a recognition that it's just, depending on local circumstances, may not be possible to get everything all nicely fit together in a short few months.
Again, the phone lines are available if you want to ask that. One just came in. Is it allowable to have more than one of any of the core partners located in a single one-stop? For example, can two community colleges partner to be located together in a single one-stop?
LaVon, do you want to respond to this instead of me starting?
Sure. Well, first of all, we're talking about, when we talk about community colleges, in that case, you're probably talking about the CTE Perkins partners, post-secondary Perkins CTE. So yes, two community colleges can partner to be located together in a single one-stop, because in many areas, local workforce areas will have several community colleges. So there are a couple ways to approach this. One is that you could share, you know, being in the one-stop, so you've got the full time. The other is that one college could be in the one-stop, and they work together behind the scenes with all the other community colleges to bring the funding together, you know, to cover the infrastructure costs. So you know, you've got one sort of in front, but it's seamless behind. You know, or you could rotate people, you know, in and out. But if you're all in that local workforce area and there's one-stop, you know, and let's say there's 3 community colleges, you need to come together to figure out how you're going to cover infrastructure costs and provide the career services in the one-stop. Now, we are working on a couple policy letters and one of them would be for CTE, and defining, and I think the recommendation is that the local colleges would define a person that would then negotiate, sort of take the lead for the CTE post-secondary Perkins in the local workforce investment area and pull everybody together. So we're trying to get that done so we can get it out to you. But that is the thinking right now for CTE post-secondary Perkins. So yes, the answer is yes.
And Levon's
Does that help or not?
We're about to find out. Levon's response reminds me, though, of something that I probably should have mentioned on the service delivery part generically, and that is the requirement is that these services have to be made available at whatever they are at the Comprehensive One-Stop Center during normal business hours every day. So it's not okay under WIOA to say, well, we're going to locate one staff there on Friday afternoons, and that's our commitment. That doesn't get it. The requirement is full-time access on demand during normal business hours, during the normal business week at one-stop centers. And that, too, is substantially different from WIA, for example, for those of you that were involved in that program. So it's a full-time presence, and it doesn't have to be on-site. And the part of Levon's answer saying 2 community colleges could work that out to provide that full-time presence is what reminded me of that. But it is a requirement for a full-time presence during normal working hours at a one-stop for all required partners. And you either do
including
that
adult
physically
ed.
With on-site staff, or you do it via technology, or you do it via contractor staff. You have to, whatever way a partner does it, it has to fulfill that requirement.
Right.
And that would pretty much apply. Oh, go ahead, Levon.
Okay, I was just going to say one more thing. Since there are adult ed, we're working on an adult ed policy letter also, and there is, we're taking a little bit different angle on that, although the same thing holds true. 2 or more partners can certainly share in the one-stop, but how we're looking at that, because they have a seat on the local workforce innovation board, what we're looking at there is that the local adult education representative on the workforce board, would be the person to pull together any adult ed providers in that local workforce innovation area and work out the infrastructure and how they're going to all share that. So that would be that person would be the MOU negotiator, once again, with a seamless with all the other adult ed providers working with them. That is our thinking, and I have passed that draft on, and we're continuing to work on it.
That's great to hear. I think the overarching message, though, is if there's multiple entities providing the same service or from the same organization, they just need to work together to ensure that full coverage is available. Sounds like adult ed has gone a step further to identify who's going to coordinate that discussion, and all others, if there are multiples, should, work together to identify how that's going to work as well.
And they are, and I think some of the other required partners are looking to the adult ed policy as a model to boost. And that policy, as Levon indicated, is under development now.
And we were really waiting to make sure there weren't big changes with the governor's guidelines, so that because referencing in governor's guidelines is an important element of the policy letter.
Right. And now you don't have to wait anymore. That's good news.
Nope.
We don't want to forget Vince's question earlier that we held off until we got to this segment. We don't think you got to it necessarily. Will the WIOA director, and we were assuming they meant the Title 1B director and staff, be the ones who direct this process of MOU creation and negotiation?
Well, the answer is for the MOU negotiation, it's whoever the chair of the local board appoints. But for infrastructure costs, the additional requirement is it's got to be somebody, either a private sector member of the board or other impartial individual. So this is a local board driven process, and the local board chair will decide who it is that's going to lead the negotiation process, and the governor's guidelines put this additional requirement on for cost negotiations, that be somebody who's impartial.
Any additional questions on the timeline, which was our fourth segment today, before we move on to final comments? Again, utilize the telephone if that's easier and quicker for you to do.
Okay, then just to wrap up real quickly and say, first of all, thank you for taking time this afternoon to participate in this webinar. We understand the tremendous amount of work that lies before everybody to go from where we are now to having fully negotiated and agreed upon MOUs in place throughout the state. So we appreciate your time in this webinar, and also the effort that comes after this time. In terms of where you go beyond here for questions, each of the partners has identified someone who will coordinate questions, and those individuals are identified where exactly?
There's a monthly newsletter that goes out and is published on the WIOA implementation portal, and it's called Illinois Works Together. And in every issue that we publish, there's always a sidebar that includes the name and contact information for a representative of each core program partner. And what we are going to work on is to see if we can get a representative of each required partner also, but that's not yet in the newsletter. We'll try to work on that and have that in one of the next issues. And additional resources are available on the WIOA implementation portal, which Chelsea Jones just so kindly posted in the chat box. And so please go to that portal. It's public. There are some password-protected areas for the working groups that are generating and helping to generate these documents, but there are many resources available on the public portion of the site, and you do not have to have a password to view them.
We also have specific area for regional planning on that site where all of these webinars will be recorded and placed, so that if staff aren't available to attend one of the sessions, they certainly can go to that after they're posted in the next 2 to 3 days to review what was presented, as well as the questions that were asked and responded to. And I think we've allowed enough time to get to everybody's questions. If there are any more, please take the opportunity now for any final follow-up questions that you may have that you have yet to provide to us. The next, if you have staff that weren't able to attend to today's session, we had one this morning, and then this one this afternoon. We have 2 more tomorrow, one again at 10 and one at 2 o'clock. So please have them participate in one of those if they have not already been able to do so. All right, with that, I think we have addressed all the questions. We appreciate your participation again, and look forward to following you as you go through this process. Thank you very much.